Welcome to the first inaugural Coffee with Cade. Hope you guys are out there doing something fun and there's something good in your mugs. We have two fabulous ladies who have joined us today. First, we have Miss Nicole Hoffman, who is an infertility warrior and who has just encouraged and inspired so many by sharing her own personal story. And then we have Miss Aisha Warren, who works with the Donor Egg Bank USA and California Cryobank. So, ladies, we're going to just have a chat, a little girl time, a conversation, not a presentation. For you guys out there, if you want to join in the conversation, please feel free to just send in your questions, and I'll do my best to share them and get them answered online. So, at this point, Nicole, would you tell us a little bit about your story?
So, my name is Nicole, as you know, and almost 3 years ago I had to have an emergency hysterectomy after childbirth because I had a large tear in my cervix. I kept bleeding out, and eventually after about 6 hours of operation room time, they said, we're going to do an emergency hysterectomy, take her cervix and her uterus, and that should stop the bleeding. So because of that, I of course can't carry, but I was left with my ovaries, so my husband Ryan and I could, create embryos.
And pretty ones.
And pretty ones.
I've seen her baby. Gorgeous.
Thank you. So yeah, so that's kind of the Cliff Note version of my story.
And why did you decide to get connected with Cade?
I actually found out about the Cade Foundation last year through someone else going through infertility, and they brought up the Cade Walk for the Family, Race for the Family, sorry. And so I was like, oh, let me check this out. So I did it, and the race and the Cade Foundation, everything that it stands for, gave me the courage to finally tell my story. I really hadn't told many people. It was just people very close to me because I wasn't embarrassed by it, but there's just such a stigma that you shouldn't talk about being infertile. It's weird. I don't know. And not so much that it was just very raw to me as well, and so I wasn't really ready to share it with anyone. But once I found out about the race and the Cade Foundation, I was inspired to tell people, and it was incredible. It definitely helped this healing process, for sure.
Awesome.
So many people have reached out to me and said, hey, we're also struggling, this and that. Thank you for sharing. Yeah, and it's crazy how many people are actually struggling, and nobody talks about it. So I'm like, I will tell you the good, bad, ugly, disgusting TMI. I'd rather overshare than make someone feel like they can't talk about it. So, and I'm not one for really filtering myself. So.
Well, shameless plug, we have another Race for the Family coming up on Saturday. So I'm hopeful that some of you guys out there will join us at the zoo from 7 a.m. until 10 a.m. We're going to be walking, running, and overcoming together. 5K, are you running?
No.
Walking?
Well, because I have a child, I have to walk with her.
Right.
That's it.
It's the baby. It's the baby. I understand.
Yes, but it is beautiful. Last year's event was the first time, like I said, that I've gone, and it was a beautiful event. So
thank you.
If you haven't signed up, definitely sign up.
Sign up. So www.raceforthefamily.com. Shameless plug. So Aisha, tell me a little bit about what you do with Donor Egg Bank USA, and why do people come to you?
Okay, well, I guess I'll start back in 2000 when I really just became interested in helping people become parents. And I wanted to go back to school and be a nurse midwife.
Are you a nurse?
No, I just played one for 17 years. I'm a clinical ethicist.
Okay.
Which is a little bit, a little weird, but I needed clinical experience. So I started at a place called Genetics and IVF Institute and fell in love with it, and really just, I think, I found my calling. And it's an interesting mix of helping a family go through what they're going through, just, by bringing what the doctor says into layman's terms. I think that's very important. I think most patients hear the doctor and they go blank and they ask no questions. And they get in front of their nurse coordinator and they're like, what did he just say or she just say?
Right.
What do I do? And
why is it that nurses make people feel so much more comfortable than doctors?
I just think we get a little bit shell shock in front of the physician.
Okay.
Right? We're trying to present our best self, and like we completely understand what they just said, and you get in front of the nurse and you've had time to process.
Okay.
I specialize in third-party reproduction, so mostly work with patients who need donor egg or donor sperm, surrogate, or all three. And that's a more advanced reproductive technology, and it's really emotionally trying. So the hardest thing for me would be when the physician would tell the patients that they need donor egg, and the patients have no idea. And they would bring them to me as if, well, hey, it's a no-brainer. Your next step is meeting with Aisha, and she's going to hook you up. And, the families are just falling to pieces at that point. They can't hear anything yet. So I really wanted to make sure that we created a safe space for them to kind of give them all of their family building options, because they're at a crossroad at that point. And I wanted to make sure that they understood, that we will be there for them if that's the choice they make and when they're ready, but they don't need to rush it. And that's what, kept me in this field, really feeling like I shared the journey with the patients.
So let's talk a little bit about that. The title for this episode is What's Up with DTT? Different types of treatment. So you just mentioned third party, donor egg, another is gestational carrier. Nicole, you talked about that. Can you talk a little bit about some of the challenges people have emotionally with the whole concept of using someone else's womb, someone else's uterus to have your baby, or someone else's eggs? What are some of the things that you've heard, and why is it that you think many people make the decision to move forward and, you work with a gestational carrier and egg donor, and I'll be fully transparent. My mom carried my babies.
All three of them.
All three of them at the same time, and she was 55 when she delivered. So I certainly made that decision. But I'd love to hear your thoughts about this.
So personally, it was very difficult for me in the beginning to even think about someone else caring for me, because I was like, this is my God-given right. Like, as a woman, I should be able to, I'm like tearing up. I should be able to do this. And so that was...
Some more coffee.
Or whatever's in the mug.
Or whatever's in your mug.
Next time I know. But yeah, it was tough. I couldn't, I just thought about it and I'd be like, how can I'm very type A, like how can I trust someone else to carry, my baby, and then at the same time not make me feel like I'm an outsider looking in, or, she, like I said, it's my God-given right as a woman to be able to carry a child. So that was rough. It was a slap to the face in a way, and it was something I just had to process and get through. And we have someone very dear to us who has volunteered to carry for us.
Yeah.
So, and it's the most perfect person ever. So I think that helped. It couldn't have been just anyone to do it. It couldn't have, because it would have been very tough for me. So, I mean, I don't know. We'll see. But it's not going to be easy.
Right.
But it's still, I think it's going to make it a lot better, this person being who she is.
I think for me, I know that I didn't necessarily feel like it was a right, but I felt like it's the only essential thing that I should be able to do as a woman. Like, I don't have to, I just have this uterus and it's not working. And, I've been preparing ever since I was 9 years old for it to do one job. And I felt like a failure. I felt like, well, if I can't have babies,
then what?
Right.
Right.
Yeah.
My whole sense of what is a woman? Of course, it's more than the sum of uterus, vagina, and breasts, but I did feel like, what am I doing? You know, what is my purpose?
I think that's normal. I really do. I think many patients feel that way. You know, you ask the question, what is it like to use somebody else's eggs and make that decision? And I have a personal bent to that too, because I did do several rounds via egg donation, and I was not successful and decided to finally move on. I have secondary infertility, and that was a good choice for me. But during that time, that was really rough. So, you know, supporting patients and then going through this as well, you know, you realize you privilege different things, but for a lot of women needing egg donation, what you're really grieving is the loss of your own genetics, right? The things that you thought you could pass on, and some of the things you hated, right? You know, at first I was like, okay, I'm going to upgrade because I am short, and my daughter needs to be tall, and I have curly hair that does not stay down. And so, you know, ironically, the donor that I chose had curly hair and was short, right? I mean,
she looked like you.
Yes, you're right. You know, because to me that was important. I think patients bring something different and unique to the table when they're looking for a donor, but what they're really trying to do is, how can I make a connection? You know, first they're grieving the loss of their own genetics, and they're trying to make a decision. Is this right for me? There's lots of options, but is this one right for me? And once they make that decision and they move forward, they're really just, okay, let's focus on being a parent. But can we do it with somebody that might, you know, look like me, or look like my sister or my cousin? And just be comfortable with that choice. And I think we all second guess that too. I honestly do.
Well, I'm going to check in with our intern for 1 second. Kayla, can you tell me how we're doing? Because I can't see it on this one. I know that it took me a good while. Can you see anything?
It says someone joined.
Okay, good.
Oh, no.
So it took me a good while to, when I say good while, I mean like, my husband and I struggled with infertility for like 5 years. We had lots of fertility treatment before we were counseled to work with a gestational carrier or adopt. As some people would say, just adopt. What an ignorant thing to say. No one just adopts. Adoption should not be a second option. It should be a choice, a first choice. But it took me some time to get over my ego, because I was thinking, you know, I worked with my mom, and my mom was 55 years old when she delivered my triplets. And I thought, I'm in my 20s. This woman has gone through menopause. She's over the hump. And she's actually going to carry a baby. How can she do it? And I can't do it? Once again, that whole sense of failure, you know, how I looked at my femininity was challenged. And when I really got over the fact that, okay, you know, life may not be fair. It just is what it is. Move on. It took me some time to get over that. I don't know. I mean, have you thought about that, and you know, have you encountered that in your practice?
Yeah,
fairness.
Oh my gosh, it was part of my every day, every minute for a very long time. This isn't fair. It's not fair. And then the whole like, what did I do to deserve this? And like, I'm not good enough, and all this stuff. Yeah, it's a roller coaster. It's definitely tough getting through it, and you eventually do, some way or another. You do. You gotta just keep going, and when you're ready, get up, keep going. Like, I would have like pity parties for myself. My husband would be there while I cried. Thank you, Ryan. And then,
Ryan.
and then the next day, I'd pick myself up. I'd start it over fresh. Sometimes I would fall right apart right away. Sometimes it would take me a couple hours. Sometimes I go the whole day. I mean, now I feel like I've gotten through the majority of it.
So what did you do that can help other people? Like, what were your strategies, techniques? Who, other than Ryan, because everyone cannot have him, he is taken.
And let's be real, no offense to men or Ryan, guys don't get it.
They don't get it. Sorry.
They will try, and Ryan tries very hard, and he admits it. He's like, I'll never fully understand it, but I'm here for you.
Well, he's honest.
And that, exactly,
Yeah.
Honestly, like connecting with other people who had gone through similar situations. I mean, I didn't find many who went through very similar situations to mine. Everyone I found who had had a hysterectomy had elected to have it, and I was like, really? Really? You can elect to have these things? But it really, there's a great support community out there, you know, reaching out to people, just talking. If anyone's struggling and wants someone to talk to, let me know, let Camille. And we know a bunch of people who have been down in the trenches and come back out.
Absolutely.
But yeah, just talking about it honestly has helped me. Like when I shared my story last year because of the Cade Foundation, the past year I've progressed so far emotionally. Like I really have. So thanks, Camille.
Goosebumps. Just got goosebumps.
So yeah, I think it's just talking about it.
I think that's true. I think
You're not alone. Basically.
I was going to say the fertility journey, when you're in the middle of it, it's like a dark tunnel and you just cannot see the light. No matter how many times people tell you there is a light at this end of this tunnel, it permeates every aspect of your day. And it even colors your relationships, right? Your best friend gets pregnant and all of a sudden you're bitter, you're not happy. And
Oh my goodness.
that's hard. It's really hard to deal with. Because you want to be present and you want to engage again, and you just feel like there's just this veil that's been thrown over you. And I've seen that time and time again. I would say for support, talk to somebody. Lean on your nurse coordinator. They really are trained for this, and more importantly, they're doing this because they feel a calling too, right? So I always loved it when they said, "Hey, I'm just going to vent for 10 minutes," and I'm okay. Just vent, because you need somebody, and it shouldn't always be your husband who gets tired of hearing it, right? Or your best friends, or even your network. They don't quite understand, but we do, right? And so we're another resource. Just throwing it out there.
Yeah,
right?
I've definitely called Johns Hopkins nurses during our fertility journey and just been like, blah, 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 blah. As soon as they pick up something, they would just listen and let me know they're there, and I'm like, I'm so sorry, I really just needed to get that out. And they're like, oh, it's fine, trust me.
Yeah.
They loved it. I never felt like I was inconveniencing them. So yeah, that's a great point. The nurses, wherever you are,
And
doctors, nurses.
Exactly. I think the men, they try very, very hard. I used to teach the IVF class, and I'm teaching patients who have to learn how to take medications. I joke that I was publicly shaming them into giving themselves their injections, because there are some treatments where injectable meds are required, IVF being one of them. And so I would have this class, and we would go through the meds that you need to take, and the timing of the cycle and what it all means, trying to demystify this.
Oh, yes.
Because that's important, because otherwise this seems like a what the heck process. But at the end, I would talk about how important it was to at least recognize or acknowledge that these men usually feel pretty darn helpless, right? They're trying to fix this the situation, and they
Men are fixers.
not know what to do. Yeah, they don't. So I used to recommend, going out on a date night or a date day, and you guys are not allowed to talk about what's going on. You're going to find another topic of conversation and focus on that.
Helpful.
And I don't know if anybody followed that advice, but it works for me.
So to use I'm a huge fan of The Matrix, like all of them. They are collectively my favorite movie. Just put them all together, I could watch it for 12 hours. But there's a line from The Matrix where Morpheus says something like, "It's like a splinter in your mind driving you insane." And I felt that way about infertility. It was like I couldn't get away from it. Even if I wasn't talking about it, I was thinking about it. Even when I was at the grocery store shopping, then there comes this lady with a big belly, or if I'm at the mall getting something, or if I'm just walking out to the mailbox, I could not get away from it. Even in the animal world, the animals are always having babies, and one of the reasons why we actually have the race at the zoo is because there's a huge fertility program. They don't call it a fertility program. It's the whole point is to keep species diversity so that, there's not inbreeding, but they get fertility treatment. Those animals get fertility treatment. They do. Sperm shipped all over the country, and all that stuff. So, there are some similarities between what we experience and what goes on in the animal kingdom. But I just felt like I couldn't get away from it. And there was this, so it was in the background, and I just felt so alone. Because when I was going through it, I didn't know of anybody who was having fertility treatment. That was something that people on TV did.
Right.
That wasn't regular people stuff.
Mm-hmm.
You saying, that you felt that way too?
I did, but I was also empathizing with you because I know, your mom carried for you a few years ago. And even now, I feel like now it's starting to become more. People are branching out and communicating about it. But, I mean, I'm sure when, like you said, when you were going through it, no one talked about it. It was like such a taboo thing, or it was, I don't know. Just,
right.
I honestly, I don't know why people don't talk about it.
Right.
I guess because it's so
personal.
personal. You're vulnerable, you let your guard down kind of thing. You let people in. I don't know.
But there's that shame factor. Like, we're told somehow, if you're not, and I get it from kind of a social perspective, but also in the faith community, I feel like there's a stigma to not being able to be fruitful and, have kids. I know that I certainly felt like one of the loneliest hours for me during the week was when I was at church. Because there were all these babies and messaging that I perceived as be fruitful and multiply, and I was trying. Yeah, come on.
God, where are you right now?
Here, right?
Help, please help. Yeah, so how do we get over that? Like, how do we make people feel, well, first of all, how do we take away that stigma, that destigmatization?
I think we just have to really keep talking about it, because the truth is 1 out of 8.
1 in 8.
1 in 8 need some type of fertility intervention. And, part of it's access to care. I think people think about fertility clinics and they see big old dollar signs like, oh, I'm not even going to try. I'm going to try a few more years before I get there. And the truth is there's a lot that can be done, even at that first visit without having to think about things like IVF or even needing donor egg. There's some other interventions that can be done. So, I would encourage everybody to talk to their OBGYN. If they don't feel like they're getting anywhere with that, go straight to an RE, a reproductive endocrinologist. And
okay.
they specialize in that. It's not a commitment, it's just a conversation.
I like that.
It's true.
Yes. Nicole?
I agree, just being open and communicating and just spreading the word that, this is, like you said, 1 in 8. This is a lot more common than people let on that it is.
Mm-hmm.
Unfortunately, that's the truth, but fortunately, there's a big support group out there.
Yes.
Mm-hmm.
You just have to, once you're ready, just reach out to someone and someone will be there. They will.
So, reach out, tap it, identify your local resources. Don't be afraid to share. I know that there have been, at different times in our history as of this country, there were other medical conditions that were really taboo. But now, there's so much support and support in the popular culture. So I'm thinking of breast cancer, prostate cancer, erectile dysfunction. My God, if I see another Cialis commercial, what is the bathtub? What is it with the bathtubs? I don't understand those bathtubs.
This is why I don't watch commercials.
I just feel like there are so many other conditions that used to be taboo that they figured out how to, maybe it was just doing it, just saying, we're going to come up with something that says this is no longer taboo. What can we do? What can we come up with to just put it out there and say, we're going to take this off the taboo list? How do we do that?
talk.
Oh, yeah.
Keep talking.
And I think if you're comfortable with sharing your story, share it loud and be proud of it, because you're a parent because of this at this point, and that is hope. That's the hope that people going through the journey need. They can't see that light at the end of the tunnel. But we know lots of people who get there, and lots of people who change their mind and go other routes, but that's okay because they are okay at the end of the journey. They really are.
So, different types of treatment for infertility, that can include many, many different things. So what are some different types of treatment that you all are aware of that people may or may not know about?
Personally, I did IVF, so I know that.
Okay.
I'm no veteran at it. I did 2 rounds of it. Never thought I could even get through 1 round, let alone be like, hey, let's try another one. My husband's like, what?
Let's do this
What?
again, yeah.
I'm like, yeah, I got this. He's like, okay, I mean, you're the one giving yourself shots every day, so.
Except that last one. Did he give you the butt shot?
I only needed 1 butt shot.
Okay.
The other one was in the front.
In the belly? Yeah.
Yeah. It did, 1 round was in the butt. Well, right here
In the hip. It's like, at least when I was going through it, there was 1 needle. I swear, it was like 6 inches long.
Well, that's what I told my husband. I'm like, I can't do it. And a little funny story about that is that, Ryan, you'll like this. So you have to mix the meds, and everything is so precise. You have to do it at the exact time, blah, blah, blah.
Yes.
So I haven't shared with these guys yet this story, but I mixed the meds, and I'm all flustered because I know this needle's so big. It's the only one that I'm going to have Ryan give me. The other ones I've done myself because, again, type A.
Yes.
And I lay down on the bed, and I'm like, okay, just do it. And the wonderful, wonderful nurse at my doctor's office drew circles in both sides just in case, like, one I wanted to do instead of the other. She was like, I'll just mark it so your husband doesn't have to, like, think about it. He could just do it.
That's so sweet.
So I, like, brace myself, and he does it, and I'm like, he goes, yeah. I was like, are you going to do it? He goes, I already did it. I'm like, oh, it doesn't hurt. But you're supposed to, like, draw back to make sure you didn't hit a vein. Well, I had it confused.
Oh, no.
I thought you had to get some. No, I didn't try to, but I thought you had to get. I mean, again, I had like IVF brain, whatever. So he was like, "There's no blood coming in." I'm like, "I don't know what to do." I'm laying there and I got this needle stuck in me, and I'm like, "I don't know what to do." He's like, "I don't know what to do." I'm like, "Whatever, just shoot the medicine in." So he shoots the medicine in, and he goes, "There's nothing in there." Apparently, in my like freaked out mind over this needle, I never actually put the mixed medicine in the syringe. So there was nothing to like pull back or
Oh no!
So he had to do it again, but to the other
side. So you need to go for those bullseyes.
Exactly. Like
That's
everything
funny.
happens for a reason. This wonderful nurse drew it on both
hilarious.
sides. So yeah, I kind of went off on a different path, but IVF humor, but
That's good stuff,
it's
though.
a good bonding thing. I'm like,
Yes.
just do it. I don't care. And he goes, there's no medicine. I'm like, what do you mean? Of course, I'm like, what did he do wrong?
Right.
Even though I didn't let him mix anything or do anything.
Right.
Shove a needle in place. So,
Oh, man.
but yeah, so
That's good stuff.
yeah, so I did the IVF journey. I'll be honest, I didn't really know anything about any of this until I started going through it. So it's very overwhelming. I know some people who have done IUI, which that's still pretty foreign to me.
It's intrauterine insemination.
Yeah.
Yeah,
Okay.
but
Turkey baster.
turkey baster, yeah. So.
Kinda.
If Dr. Bill was here, she would probably cringe at that.
Maybe it's the long catheter that goes through the cervix. Yeah.
Extremely tiny turkey baster. Long, thin turkey baster. But, okay, so IUI, intrauterine insemination, IVF, in vitro fertilization, and that's where they, the woman takes meds so that she produces a bumper crop of eggs, and the man goes into a special room.
And has the worst part of this whole process.
You know,
Seriously.
don't they make it seem like that room is
Cry
just...
me a river.
He's like, yeah.
You're in a
He's
room.
like, but it gets in your head, like, what this room is for. And I'm like, listen, I've shot myself with multiple needles every day.
That's right.
I get it, that's creepy, but I win.
You're doing the same thing that most guys do in the shower. Okay.
Exactly.
So, so the guys go into a special room. I think they call it the masturbatorium.
Oh my god.
I've heard that term.
I have not.
Collection room too.
Collection room. Yes, that is.
But I like masturbatorium better. Yeah.
It's a little. That's more sanitized, but they don't go into this special room, and then the embryologist, I guess, mixes the egg and the sperm. Outside, of course, in the lab, and then they let you know this number of eggs fertilized, and then the next day it's, you know, this number of eggs proceeded to the 2-cell stage, and 4-cell and 8-cell.
And it whittles down, and
exactly.
Yeah, that's something to definitely prepare yourself for, is the attrition rate, because you know you're hearing, woohoo, you got 15 eggs, I'm gonna have 15 chances, and then you know the normal fertilization rate, even with ICSI, which is a type of procedure where they can put the sperm directly into the egg to help. Even with that, it's about 80%. And so we're all excited if we get an 80% FERT rate in the clinic, and the patient's like, wait, what happened to the other? And that's normal. Right. And then you know they honestly stay in an incubator, and they get cultured out to usually blastocyst stage. And, you know, you can have 15 go to 3. And people get so disheartened. But we're all high-fiving ourselves in the back, right? Because we're like, we've got 3 great blastocysts. We've got chances. But if you're not prepared for that, that attrition can really be, that can really hurt you. That 5-day wait from retrieval to transfer.
Yeah, so my first round, they got 18 eggs.
Oh,
we ended up with 1 embryo. To be honest, we ended up with 2 embryos, but then we did PGD testing. I don't know, I don't recall what that stands for, but we did additional testing of the embryos to see if, you know, that they're healthy. And one of the embryos came back that it was like 99.9% chance of first trimester miscarriage. So we went from 2 embryos down to 1.
Wow.
But I was the same way. I was like, we got 18 eggs. Like, that is incredible. Like, we're going to have 1,000,000 embryos to work with. And then they're like, you have 2, and now actually you have 1.
Right.
And you're thinking, I was like, all of that. I did it. But, I mean, all it takes is 1, though.
That's right.
All it takes is 1. I know many people who said we had 1 chance, and it worked. But yes, that's a very good point to bring up, that
that part can be really difficult if you're not prepared for it, right? And if you have a ton more, icing on the cake.
Yep.
Right.
So PGD is pre-implantation genetic diagnosis. And that's when they screen the embryos to see if there are any genetic diseases, or if the embryos somehow are not normal. So that's great to bring that up, because when I was going through fertility treatment 100 years ago, I feel like that grandmother that's like, when I was coming out,
I walked to school bare feet in snow uphill.
Exactly, 12 miles. Yeah. But when I was going through fertility treatment, nobody got blastocysts.
That's right. They were probably day 2 or day 3s.
Day 3. You know, and kind of at the end of my 5 years of treatment, I heard people starting to talk about this blastocyst thing, and I thought, who does that? Why would you wait another 2 days?
Right.
Well, because you get better outcomes. But it's just really, I've been amazed at the improvements.
Right. The rate of advancement.
Right.
Yeah.
So PGD, I think, is very common now.
Yeah, it is.
And that makes such a huge difference. But it's just not something, maybe it was done experimentally, or it was done, you know, for a small subset of people, but it just wasn't something that they never even talked with us about.
Yeah,
it was crazy expensive.
It is.
Really. Now it's still pricey. I mean, when you're looking at the grand scheme of things, though, how much out of pocket you pay. If we had transferred that embryo, like,
you would have gone
the emotional loss, the physical loss, or you know, our gestational carrier, like everything. So it kind of put things into perspective. Like, hey, yeah, this is going to cost us a bit more money, but to us, it was worth it.
Yeah, it ranges from like $2,000 to $3,000 per cycle for PGD or PGS, also pre-genetic screening.
What's the difference between PGD and
PGD is looking for specific diseases,
Okay.
right? So if you know that you're trying to just transfer an embryo that's not been affected with specific disease, that's PGD.
Okay.
PGS is genetic screening, and it's really looking for euploid, aneuploid, and it can tell gender as well.
Okay.
So it's kind of like the whole spectrum.
Maybe we did PGS then, because they said we could know the gender
but
if we wanted to.
people go back and forth with the terminology, no problem. The real reason why it's changed is there's something called next generation sequencing, and it's a type of technology that's just been a lot more effective at figuring out if the embryo's affected. Because before you would get these indeterminates, or we've got like a 60% chance of thinking this is. What do you do with that? 60%. Do I transfer? Not transfer? Why do I even pay for that? Right?
Sounds like 23andMe.
That's right. Right.
I want my money back. Seriously.
Really? I want to hear about that. No.
Oh my goodness! They were like, there's a 70% chance that you like coffee.
Oh, you're right. Yeah.
What does that mean? I mean, I told you I like coffee in my questionnaire. So what are you telling me? I want my money back.
That's hilarious. I
It's
didn't know
true.
that. Yeah.
It's true.
Too funny.
So,
I was going to mention, if you don't mind,
Yeah.
there's another treatment that most people don't really talk about. It's timed intercourse. It's kind of old school, but if you're really not sure you want to do anything at all invasive yet,
yes.
you can go to your RE and tell them, and they can give you medication that will help you ovulate, time the ovulation, and kind of tell you when to do business. And that helps a little bit.
So is that like Clomid? Or
It could be Clomid, or for some people, although not many doctors do this, it could be gonadotropins, like Gonalef injections. But it's just a little bit. That would be too
Isn't there a
invasive
risk for
multiples.
Yeah.
You have to. You're gonna have something invasive if you're doing, gonadotropins.
Yes.
Either the transvaginal probe or,
That
something
was fun.
invasive. Yeah.
every day
Right.
for 2 weeks?
You lose your modesty. You just okay.
Yeah, that's exactly right. So a transvaginal probe is an ultrasound where they insert the ultrasound probe in the common vernacular, the hoo-ha, instead of on the belly.
Yeah.
We call it the JJ in our house.
Yeah,
the JJ.
Thanks to our wonderful caretaker nanny.
Yes. So the hoo-ha, the JJ, wherever. It goes inside, not on top. And that happens pretty much every day for however long you're being monitored when you're going through fertility treatment.
Yeah.
So, yes, you do lose your modesty.
You do. That's okay. Get used to it. You start chatting to the ultrasonographer, the nurse. You just find ways to cope, right?
How about them O's? How are they going to do this year? Yeah, so transvaginal ultrasound, IUI, IVF. We've talked a little bit about donor gametes. Let's talk a little bit more about that.
Sure.
How do most people go about selecting a donor? Do they look for someone who looks like them? Do they look for, I'm from Ohio, and I think I want somebody from Ohio. What is it that you see that people look for?
There's a lot of different things, but predominantly, like the phenotype, right? So things that they feel will, once they have passed on, what they would pass on to their offspring, they would pass on as well. So, like I said, for me, it was curly hair.
Mm-hmm.
All right, well, if my child had curly hair, then there's less of a chance that someone's going to come up to me and go, wait, how did that happen?
Mm-hmm. Right.
And that's the big fear, is somebody saying to you, that can't be right, that's not right, and you just can't keep it private anymore.
Mm-hmm.
So, usually they're looking for their mini-me, which is really hard to find.
Mm-hmm.
And so this can be a process. You really, you're going to spend a lot of time looking through profiles, and some profiles are really short. They don't give a lot of information, just childhood photos and snippets of medical history.
Okay.
And others are really in depth, and they give photos of how the donor looks now. They give essays. They talk about SAT scores, ACT scores, just the gamut. So
Is that the designer baby?
It can be, although you know what I honestly find is most women going through this try to find a connection with their donor. You know, usually you get to the point where I could have a cup of coffee with her. I don't even know who she is, but I could have a cup of coffee with her and I feel comfortable. If I have to go through this journey, which I don't want to do, but if I have to do it, maybe I'll go through that with her, right? And so you kind of humanize because this is definitely a human process, even though you might not meet your donor if you're going through an agency or your clinic's donoring program, right? It's usually anonymous, or at least you're not going to meet right off the bat. And then there's women who are not always successful right away, and they change their mind about what's important. They get to the point where they just say, I want to focus on the parenting. Show me the donors who've been successful with other families. Let's just go with her. You know, I've seen that time and time again, too, where they just kind of go, I'm done. And usually once it's, third or fourth cycle with donor eggs, which can be a little pricey and definitely emotionally draining, you get to that point. The good news is, if you're persistent, it almost always pays off with that treatment.
So you said something that kind of tickled my, my brain somewhere when you talked about people wanting the kid to look like them, or they don't want those questions. Let's talk a little bit about privacy. Do most people that you work with feel comfortable sharing that they went through a donor cycle? And then also let's talk a little bit about gestational carrier, because that's something that you are looking to do. How do you feel about people knowing?
I would say a lot has changed in the 15 years that I've worked in this field specifically. It used to be that disclosure was not something that they were even considering, parents were even considering telling their own children, much less strangers on the street. There's been a lot of research about that, and so disclosure is actually pretty, commonplace now. A lot of people feel like, you know what, this is just part of your story, and I'm going to eventually tell your story to you so that you're aware of how this all happened, how we built our family. But there is something still very private and raw, that your emotions still kind of get the best of you, when you're just being honest in front of a stranger. So I would say the vast majority of people aren't very open about it, about this being the avenue, unless there's a reason to be. Unless they heard a friend saying, I got to go through this, and then all of a sudden they're like, okay, back up. You may not know this, but, I use a donor, or, so it's rare. And I think that's because in society, we're not embracing it either, right? You'll see 52-year-olds get pregnant, and they say this was, natural conception, and I'm over here going, okay, probably not. I can't say no, it's not definitively.
Why are you always lying?
But nobody wants to own it because it's just such a very private thing.
Right. But why is it, by not owning it, what we're saying is we're ashamed of it?
Are you on the homepage?
In some ways.
You could be saying that. Or you could also be saying, I just don't want to answer these billion questions from these strangers who are already insensitive. Right?
Well, that's true.
Right.
That's true.
Some people are very private. That's just how they are, I think. And some people, opening up that door to share with other people, it's not comfortable for them, and it just doesn't feel right. Whereas me, I'm like, bah.
Right.
Same thing with you, too. I know that. Not that you're like blah all the time, but,
No,
you spread the word, and you talk openly about what you went through and everything like that. But I think there's just so many people out there that maybe are a lot more private than we are.
So I feel like, everybody doesn't have to be me, but at least with my story, I felt like either I went public and I just talked about it, or another narrative was going to be written, because it was really, really controversial when we had our babies. I remember doing a radio show, and this man called in. We only did literally 2 interviews from the hospital. They were back to back, and total 15 minutes. And from that 15 minutes of 2 interviews, we were on every morning news network. We were on CNN. I mean, there were hours and hours of news content created, and I just, it was amazing. And I know that it was all out there because the hospital packaged all of the stuff up and gave it to us like a parting gift. Here's this videotape, this cassette tape with all of this stuff that has been gone on regarding your story the past couple weeks. So I thought, if we don't tell the story, the media is going to do what they do. They're going to make up a story, and it's probably going to be something crazy,
and not positive.
And certainly not positive. And I remember this one, I was doing a radio show a couple years later. This is after we had started Cade Foundation. We were just getting started. And I was still kind of raw. I was still getting used to telling my story, but it still, hurt. I've got, a keloid and, a scar now, so I could tell it, and it doesn't matter. I'm fine with it. But back then, it still hurt. And this guy called. He was so angry. And he said, I can't believe you had a baby. You let your husband have a baby with your mom. Oh. And I just thought, look, fool, you have not heard one thing that we talked about. Yeah. Yes, you are an idiot. But there are other people who would not take the time to listen to the story. They would just say, Mom had a baby. It's their baby. There must be some Maury Povich,
Jerry Springer. Right.
You are not the father.
You are not the father.
Or you
are the father.
Right. Yeah.
Right, yeah.
So I didn't necessarily feel like I had a choice about coming forward to tell our story. But then once it was out there, it was already out there, and I just figured it didn't hurt. Now I thought it would hurt me, coming forward. I thought people would judge me and they would negatively, they would. I don't know what I thought they would do, but I thought it would be hurtful to me and to my children. What I realized, though, was telling my story was liberating. It made me feel good because I was getting rid of it, and I was helping other people. Other people, would come up to me with tears in their eyes and say, I was so encouraged when I heard your story. It made me feel like I can do it too. And, and that felt really good because I thought, wow, I'm getting free. And it's helping other people. The more I talked, the more I told, the more other people got free as well. So that's a weird thing that happens when you share your story. It doesn't hurt you. It helps them.
Yeah, it feels good. It's therapeutic. Or at least it was for me, and it sounds like it was for you too.
Oh my goodness.
It was very therapeutic for me. It was, like I said, it was the big step in getting to where I am now.
And so, will you tell your baby when they arrive? This is your birth story.
Yep. When the time comes, when we think it's right, we will definitely share it with any future child we have. But not sure how. I was very ambitious, as my good friend Sadie likes to tell me I am all the time. I was very ambitious and was like, I'm going to document this whole journey and it's going to be great and make this great baby book. Yeah, I haven't documented anything.
That's okay.
I'm like, it's okay. I got it up here and I'll share it with them. Ryan will share it with them when it happens, or when the time comes. But
so for our kids, and I'd love to hear what some of your clients have said, but for our kids, we had pictures of my mom when she was pregnant. And as, we would talk about different things. Oh, yeah, this is you when you were first born. And they'd ask questions. We had my mom's pictures right there. I mean, we had the pictures of her at the baby showers. We had the pictures of her when she was 46 inches around. We had the pictures of her the day they were born. So there was never a story that didn't include that part of how they came to be. And so for them it was so natural that I recall them going to school and talking about whatever with their friends and saying, your grandmommy didn't have you? It was just everybody's grandma has them, right? That's just normal. And I just thought, that's so beautiful because kids don't attach judgment. There's no positive or negative. It's just...
It just is.
It
Statement
just
of
is.
fact. This is it.
Isn't that lovely?
Yes.
So,
I was just thinking, you both had asked the question, how can you help get through this process?
yeah.
I think really like being somewhat introspective and going, all right, I'm on a journey. What's my narrative? What's my story going to be? And I think just having that frame of reference is very helpful.
Mm-hmm.
Good tip. I'm going to steal that tip.
What? The tip?
Yeah, make your narrative. Make your story now. In the midst of going through this, not when you're successful or,
Right.
but think of it at that point. Like, all right, I am on a path, and this is going to be my story. That's in my own mind. How will I frame that? I think that's really, that's pretty special.
Well, again, I didn't really feel like I had a choice because it was my mom, and I didn't want some creep at school or some crazy cousin.
Right.
Because, you always have that crazy cousin or that crazy uncle or, that frenemy who has wretched children that will, at the family reunion, that will just put it all out there. Maybe that's just my family. Sorry. But I didn't want somebody coming up to my kids saying, well, don't you know?
Yeah.
Right.
Yeah. Go ahead.
So I'm just going to say, so disclosure, like, what do most people do? I think that they are frightened of giving away their power. Like being able to contain that story is something that they're frightened of giving to somebody else.
Mm-hmm.
So, most patients, when they're going through third-party reproduction, have to meet with a psychologist. A lot of people get offended when, you say this is part of the treatment plan, and they're like, okay, you're evaluating me because, you want to test whether or not I should do this. But that's not really the goal. The mental health professional is there to kind of help you craft what circle you're going to tell, right? Because once you put it out there, like you said, you can't really take it back. Right, so I've had families who said, we're probably not going to tell the children, but I just told, all my family, and I'm like, well, and then your children might find out, well, maybe Thanksgiving dinner, like, gotta
so
really
true.
think about that, right? Like, think about how you can control that information. And then I think there are some cultural differences, right?
Let's talk about that.
Yeah, so, there's been a huge push in the community for disclosure on third-party gametes, right? Everybody wants to disclose it. I've worked with a couple of, patients of different ethnicities who really feel like they will be judged and their children not accepted if it's known. And that's a hard thing. You're going through something hard as it is, right? That's a hard thing to have to deal with, too, right? And I didn't want to be, the clinic who said, well, you're not going to disclose, we're not going to help you.
Right, certainly.
Right, so you just help them navigate, all right, well, let's figure out how you're going to do this. And honestly, it's fluid. I don't think everybody knows their game plan. It just kind of happens as it happens. So.
Nicole, did you have some thoughts about that?
Well, I was going to add on to what you had said about you got your story out. I said you just had to get ahead of it before
I did.
it snowballed and
well,
got
because
out of control.
you could
and
see
it could have been like you said. It could have gone on this completely crazy path.
Gone left.
You had 12 kids, 3 different people, all over the place,
and they were from outer space, and I just had a vision of the National Enquirer coming out with this crazy story. I mean, look, at that point in my mind, I was thinking, is somebody going to sneak into the NICU and take a picture of my newborns who were premature? They were 32 weekers, and come up. So they lasted a long time for triplets, but I had a conversation. How can we protect the NICU from some unscrupulous journalist who may want to create some kind of sensational story? The journalists that worked with us were very kind and very generous, and there was no one who kind of stepped out of bounds. I mean, everybody was very kind, and it was a Christmas story. My kids were born December 28th, so maybe it was people, were just very generous. But all of my fears were completely unfounded. I didn't have any reason to feel that way, but I had read too many stories in the supermarket line.
Prepare for the worst.
Yeah.
Mm-hmm.
Yeah. So, for the future, we're kind of coming to the end of our segment. Do you have any parting words for any families, whether they be just kind of starting this infertility journey, or as you mentioned, the veterans, people who've been through a good number of cycles and they're feeling like, I'm getting ready to tap out. Any parting words for them?
If you know what you want, don't give up on it. Just keep trying to get it. I mean, at some point you're going to get it, or you're going to figure out something else you want, perhaps. And you're not alone. There's lots of people out there. I know I said this like 100 times, but talk about it. If you feel comfortable, reach out to someone. But you're not alone, and you'll get there. If it's something you want, try hard. Try really hard.
I love that.
Yeah. The saying, persistence pays off. It really does. And I say it a ton, and, I know a lot of patients are like, you keep saying it. Yeah, I do, because it will. Right, it will. I don't know why some people's journey is just one cycle and some is 5 and $150,000 later. But I always say, when you hold your baby in your arms for the first time, all of that's not going to matter anymore. Right? It all makes sense.
Until that kid just drives you crazy when
That's
they're
right.
teenagers. Do you know what I went through for you? Do you understand?
Oh man, I didn't last as a teenager. I think I started saying that when my kids were 9.
Well, you had 3 of them, so
Yeah,
it was like compounded.
Well, just in parting, don't forget about the Race for the Family this coming Saturday. You will be able to connect in community. raceforthefamily.com, and we are giving away a $10,000 cycle, or $10,000 in fertility treatment at Shady Grove Fertility, who was our very generous host. So ladies, I thank you for joining me for this conversation.
You have a question.
Okay, really quick, we have a question.
If my partner has a vasectomy, is an IUI possible for conception if he gets a sperm extraction or the sperm not mature enough?
There's just not enough sperm usually. I mean, I'm not a physician, so I'm not going to pretend to be one, but there's usually just not enough sperm successfully to do what they need to do for the IUI.
Okay.
So that person would ordinarily have to have an IVF with ICSI?
IVF, you can talk about tubal reversal, right? And then maybe that'll happen just that way. Or, you could do ICSI. They could do a non-surgical sperm, like extraction. And then you don't have to go through the actual reversal itself.
Great question. Thanks for that. So, once again, thank you, ladies, for joining us for a conversation, not a presentation. And I will end today like we will end every Coffee with Cade moving forward. Ladies, what's in your mug?
Nothing. I drank.
Nothing. Oh, yay!
It was coffee.
She had coffee. Coffee, and I had Plead the Fifth. See you guys next time. Take care.